How to deal with drug abuse, a holistic approach. Drug abuse, also called substance abuse or chemical abuse, is a disorder that is characterized by a negative pattern of using a substance that leads to significant problems or distress. Teens are increasingly engaging in drug abuse, particularly narcotics and stimulant medications, which treat conditions like attention deficit disorder and narcolepsy. Initially, drug users were condemned and accused of lacking moral values and not mentally strong enough to get away from addiction. It was first recognized to be a disease like any other by Alcoholics Anonymous, who did pioneering work in this field as an organization investigating deep into the reasons why a person fell into and lost control of themselves on such usage. Dr. Jelinek's path-breaking studies helped change everybody's views about these drug users. Further, with the advancement of neurophysiological science after 1956, one came to the conclusion that drug abuse is a chronic disease. This could trouble a person for his entire life and was ultimately curable by proper treatment. The disease of addiction was thus much better understood than in the past. What was needed, therefore, was a due recognition and systematic treatment appropriate for such cases. Drugs that are commonly put to wrong use are brown sugar, which is a superior version of heroin, cannabis, which is also called ganja, bhang, and other such categories, and even alcohol, which qualifies to fall under the drug category, for the reasons that it is merely a chemical in liquid form that is used to give a high. Even thinners usable with paints and other such common material could be called drugs. There could also be a case of drug abuse where a medically prescribed item is consumed frequently and the person gets addicted to it. There are many criteria to determine whether a person is addicted or not. These could range from physical warning signs, emotional signs, to a sudden or gradual change in social behavior. The person exhibits red and glazed eyes with poor eating and sleeping habits. They may also show general lack of interest and become a victim of sudden mood changes. Developing a strange secretiveness can also be seen. Instead of looking at the causes for drug addiction, it is better to understand it as a weakness to addiction. Family and friends around a person may serve as a deterrent or cause further usage of the drugs. Withdrawal symptoms are the symptoms that the addict faces when deprived of the substance they crave for. The body and mind becomes restless, becomes more and more irritable, all parts of the body could be affected, and there is noticeable sleep disturbance. If the patient goes back wanting to consume only a small quantity, then the brain recalls the experiences it has had in the past and forces him to consume more and more till it provides complete satisfaction. This is a state that has to be completely avoided. It would be a reminder here that the substitution of one drug by another is neither the solution nor the cure. Drug abuse, then, is the disease of the body, mind, and the soul. Though treatment may begin medically, but that alone is not enough, and the patient would need an enormous amount of psychological help. It requires long-term treatment, a change in lifestyle, and the involvement of family becomes important in these kinds of treatments. Care should be taken to see that the patient's dignity is preserved and he should always be respected. Prevention is a community process and not a single-day affair. Instilling mere knowledge that drugs are bad alone may not also work. Developing of coping skills, learning to say a firm no to drugs even when repeatedly persuaded, a good support system, echoing the message against drug addiction repeatedly at different points of time, involving all sectors of the society, are some of the preventive measures to be taken. The Union Ministry of Social Justice and Empowerment has been implementing the scheme for prohibition and drug abuse prevention since 1985-86. As implementation of programs for de-addiction and rehabilitation of drug addicts requires sustained and committed effort, a state-community voluntary partnership is in need. Accordingly, under the scheme, while major portion of the cost of services is borne by the government, The voluntary organizations provide actual services through counseling and awareness centers, de-addiction cum rehabilitation centers, de-addiction camps, and awareness programs. The ministry is assisting 361 voluntary organizations for maintaining 376 de-addiction cum rehabilitation centers and 68 counseling and awareness centers all over the country. The basic objective in creating facilities for treatment is to ensure that the support of the family and the community is organized to the maximum. To help the medical treatment of hardcore addicts who require intensive long-term medical attention, 100 de-addiction centers are being run by the government hospitals, primary health centers, etc. The initiatives from the government include professional manpower development in National Center for Drug Abuse Prevention, that is NCDAP, a top institution having the necessary mandate for training, research and development in the drug sector, and Workplace Prevention Program, that is WPP, a collaborative effort of the government, NGOs and the corporate sector. This collaboration has led to the formation of an effective group of various stakeholders known as ARMADA, the Association of Resource Managers Against Alcohol and Drug Abuse.